I think the biggest problem, obviously, is the cost of healthcare. It's what I hear about every day when I'm out there on the campaign trail. And I've said for a long time that I think the most important thing we can do on the cost question is a lot more transparency and public disclosure. I think the public would be better served if they knew a lot more about price and performance, and frankly, I think providers, docs, hospitals would be much better served as well, because there are a lot of people out there doing a great job for a reasonable price, and they get no credit for that at all, the way the system's set up now, because nobody knows anything about anything on price and performance. I think the second issue is coming to grips with the, I guess I call it the differentials that exist between Medicare, Medicaid, and what the private sector pays. Again, nobody knows, unless you've been in the business, how big those differences are or what they can mean for specific institutions. I mean, if you're one of those provider organizations or you're a physicians group that does an enormous amount of business with just Medicare and Medicaid, you have a completely different problem with regard to your ability to pay your bills and run your practice or your hospital than somebody who's got half their business in the private sector. I think the next thing, we overregulate everything in healthcare. And I've been saying for a long time that I think we should take a hard run at all our regulations, and that would include healthcare as well. You can't just keep piling them up on top of each other and expect things to ever get better. Two other things. One is nobody really understands what the full implications of the federal healthcare reform law are going to be on Massachusetts and on Massachusetts providers and on the cost of healthcare here. But I've always been a big believer that at the end of the day that law is probably going to be bad for Massachusetts. We will absorb a disproportionate share of the cuts on the Medicare side. We will absorb a disproportionate share of the tax increases on the tax increase side. We already cover 97% of our population, so it's not like we're going to get much of a benefit out of the expansion in coverage that's going to take place, because we've already done a lot of that on our own. And I just think there ought to be some way to take a run at some of these tort and medical malpractice issues. Now, I understand that everything at once, unlikely to have much success there, but can't we pick a specialty, like maybe when we have a shortage in orthopedics, neurosurgery, OBGYN, come up with some kind of alternative dispute resolution model for that, and test it. Because for years, what I've heard from physicians everywhere I go is that the cost of malpractice is a big problem for them. And the defensive medicine issue, which they worry about a lot, translates into the way they practice. And I'd love to be able to come up with some way to test that and figure out if, in fact, there isn't a smarter and a better and a less expensive way to deal with that. I think payment reform is certainly something that's worth talking about, but there are so many provider organizations in Massachusetts right now that do a pretty good job, do a great job for a reasonable amount of money, that I've never thought that the whole thing is fundamentally about payment reform. And I don't know why we should chase turning payment reform completely upside down for the entire system, when there's no real evidence to me that the whole system is broken on this one. I think Massachusetts has a fabulous healthcare system, but I believe the system needs to be a lot more accountable and a lot more transparent than it is now. And if you're doing a really great job at a reasonable price, we need to come up with ways to give you, as a provider or a provider organization, the ability to make that case more publicly to the public and to your colleagues as well.